it's an incredible privilege to have been asked to become the chief executive of the new agency. I'm going to talk a little bit about what I have as a vision for how I think some of the digital opportunities can transform health services for people in Australia and support the development of much more integrated, person-centred delivery. But I also just wanted to reflect that, I've had the opportunity in my career of working obviously in the UK and in fact globally on some of these issues. And I think that not just in Australia, but around the world, we are now at a pivot point where health has to grasp the opportunities that putting data and technology can offer for patients and citizens in many countries. In fact, I would go so far as to say, and I have said this before, that I think this is the single most important public policy agenda, the modernisation of healthcare through the implementation of digital technology. A few months ago, I was working in the National Health Service, and I was responsible for the genomics programme. Some may know that the British Prime Minister challenged the NHS to sequence 100,000 whole human genomes by 2017, and I was given responsibility for looking after the NHS end of that deal, along with colleagues from Genomics England and other bodies. And during that period, I was exposed to some of the most unbelievable technological advances. I saw, for the first time, software that completely reproduced the behavior of a living organism. I met some extraordinary people right at the sharp end of artificial intelligence, and it became clear to me that this emerging science, of which Australia, of course, has an extremely distinguished history, is really going to change everything in society. And there was kind of me at one end of this, quotes, digital agenda, just getting this very privileged overview of what the future might be offering. And then over here in my kind of day job, I was exposed to the real world in which most people experience healthcare for most of the time. And there was one lady who sticks in my memory and in a way shapes a lot of the way I think about this. A lady, a former nurse who has a child with very severe learning difficulties. And her week basically was her child having a series of emergencies which needed treatment in one of the local hospitals. She would go to the hospital. It would take her, on average, about 2 hours to be admitted into the emergency department. Once she'd been admitted, she would then be on the ward. She would have to wait a further up to 4 hours each day, this was, for the hoist to be brought from somewhere else in the hospital so that they could lift her child out of the wheelchair, put her on a bed and administer a course of treatment. And I met this lady when she was really at the end of her ability to cope with the way in which the NHS was treating her. And she said to me, the one thing, Tim, you have to do is create a health service that will remember me. And when she was being, in the conversations, every time she went into the emergency department, of course, all the staff knew her, but none of the paperwork knew her. And she was being engulfed in a paper-driven health service that had no memory of her or her child, and was exposing her to a level of disrespect and, frankly, inhumanity that is our first objective when we talk about digital health. It is simply a matter of human respect, and people who are at the most vulnerable when they are in situations requiring care needs to be respected in a way that I hope everyone in this room would agree with. And that, for me, is the essence of what we're discussing today. Integration is nothing less than respect, human respect, for our patients and those who need treatment at a point when they are most vulnerable. It's also about systems that do people harm and don't know when they're doing people harm. And I'm sure many people in the room will be familiar with the research that's been done looking at avoidable mortality in many health services around the world. Roughly in England, it's about a jumbo jet load of people dying avoidably every week, because in large part our hospitals are unable to communicate between each other, between GPs, hospitals, community services, so that people are safely recognised and treated. It's about piles of paper. I haven't yet encountered them here, but I hope to find them as soon as soon. In the UK, I would make a habit of going to a particular hospital and then diving into their paper repository. And I remember going to my local hospital in Taunton, and they had a warehouse full of paper records, which had 10 staff just shuffling bits of paper around on trolleys, and the average cost to that system, a small district general hospital in Somerset, was about £3 million, $6 million per annum just to look after the paper. So for all these reasons, but with that first respect reason in the forefront of one's mind, we have to now urgently address the digital agenda. Other industries can teach us a lot about how to do that. There has been a big bonfire of the faxes in financial services, in travel. In fact, I was very interested the other day to learn that 62% of Australians, actually more than the equivalent proportion of the population in England, is now routinely online banking in a way that they weren't a decade ago. And this has been one of a kind of quiet, huge social transformation from which we can learn a lot when it comes to healthcare. And of course, the other important fact in Australia is that the vast majority of people here want access to online digital healthcare. So the most recent survey I found, at any rate, suggests that about 73% of Australians actively want to engage in ways that are convenient to them with their healthcare system. So our vision for health should be connected, it is communicated, it is empowering people to take control for themselves, it is about transparency, it is about openness, it is not about technology, it is about improving the quality and experience of healthcare, it is about helping people to live healthy, productive lives. That is the mission that we are on here. The reality here, and yesterday I sat down with the chief information officer of one of the states in Australia, and he just went, okay, we have to stop the situation in which people are faxing electronic discharge summaries to each other, that there is no real-time prescription monitoring. And we know that, by the way, that medication mismanagement by individuals accounts for more deaths than road traffic accidents do, and yet there is no real-time prescription monitoring in Australia. In fact, frankly, very few other places in the world do it either. There's no ability for somebody to order their prescription online here yet. These are things which just have to get solved really quickly. The good news is, as I learned over the last few days, and of course I was tracking this in my previous role over the last few months, actually a lot of really great work has been done in Australia as a whole, from colleagues in the jurisdictions, in the new emerging, very energetic group of PHNs at national level. And I think it's for that reason, partly, that I took this job, because I feel that the energy around solving these problems already is very real in Australia. And I think the agency can support that innovation in ways which I think can put Australia in a globally leading position in relation to modernising the experience of healthcare. I think that 5 years from now, we will have solved these connection issues. We really will be following the lead that some states have already taken in prioritising interoperability between their hospitals and their GPs and their community services. We will finally enable GPs and specialists to speak to each other routinely, securely, electronically, a situation I'm afraid that many GPs and specialists currently find themselves unable to do. And these are things that the agency, I hope, will be able to help jurisdictional other colleagues deliver. We'll be able to support people with chronic illness in ways which currently are not available to them. And I'm incredibly excited. I'm sure Martin Bowles will have spoken about this when he briefed you earlier in the year, but incredibly excited about the opportunity of the new healthcare home policy, looking very differently, much more holistically, in actually much more integrated context in which we can actually treat people as people and support them to live healthier lives. I think we can, and maybe this is an important note for this audience, I think this is also, it's not just about social or health benefit, I genuinely really believe this is also about economic benefit. And I think that one of the great assets Australia has is, of course, its basic scientific research capabilities, and I think there's a very urgent and important role for the health community in Australia to sort of work as closely as it can with colleagues in the research environment to keep and maintain Australia's position at the very cutting edge of scientific discovery. So I think that's a very important agenda as well, which I hope individually and collectively you'll be able to support me in the agency and other colleagues deliver on. So as I say, I'm 7 days in, I am listening, and I come across 300 people who have committed themselves passionately to supporting this agenda in healthcare, my colleagues in the new agency. And I'd just like to pause for a moment and thank Richard Royal, who is somewhere in this room, for his fantastic leadership in being the acting, actually, doesn't matter first, second, but acting chief executive of the new agency. He's galvanized the team into a really shared sense of mission, and I think he's done so in an extraordinary way in a very short period of time. So I'm extremely grateful to him for the inheritance I receive. I'd also like to thank the board, and Michael Walsh is in the room as one of our board members, a fantastic group of people from a very diverse range of experiences. So I think will bring great wisdom, and I'm already experiencing that, to the way in which the agency can deliver the promise that that I think it has the potential to do. We inherit some great things, and I know these are going to be somewhat perhaps controversial remarks, but apparently I am controversial according to the local press, so that's something. But the My Health record, is becoming a real success for Australia. 17% of the population have registered for it. 4.1 million people. It's already moving to the point where I think we're in the next year or so going to be at a tipping point, and the reality of people having a very different kind of conversation with their clinician will occur. Let's be really clear, and just to paraphrase Michael from earlier this morning, this is not about creating electronic shoeboxes in which people can slip bits of paper and stuff them under the bed. This is about creating a new currency of conversation using digital technology to enable people to share with their physician, their clinician, a conversation about their health in a way that just will be dynamic and hasn't happened before. The vision for my HR is one Australia is beginning to embrace, must embrace. It's up to me and other colleagues to make sure that we do this the right way and that we design it from now on in really close co-production with patient groups, with other voices in the community across Australia, and that it's not some ivory tower project. But even today, we should recognise that it is a success. And I just wanted to mark that. Now, the honest truth is that not everything has gone well. And as I learned, there are lots of things I think that predecessors, perhaps could have done differently in relation to the way that some of the digital priorities have been debated and implemented in Australia. That's actually not an issue that's purely Australian by any means. The fact is that technology in healthcare is extremely difficult. It requires great leadership. It requires political bravery. The US, after an enormous investment by Barack Obama in healthcare, is beginning to sober up, and the sobering up process is actually very painful. There is a very big disenfranchised community of clinicians who cannot see the benefits of electronic medical records, who are finding it a much greater administrative burden than, in fact, the previous paper-based systems were. And we have to be incredibly mindful that this is a difficult priority which needs caution and patience and huge amounts of co-production. And my central message today, I don't want to run over, is that the new agency is here to listen and co-produce the future. We are not in the business of trying to do things in some sort of national, top-down sort of a way. This is all about authentic co-design with people in the community who want to help modernise local healthcare and support people in their lives. It's about creating new industrial, entrepreneurial opportunities for great apps developers over here, existing large vendors over there, to engage with the public estate, to transform the experience for citizens in England. It's about engaging, I hope, very effectively with the clinical leadership in this country, which is fantastic, and learn from their experience how we can deliver the digital opportunity in a way that is not going to be disenfranchising or disempowering for doctors clinicians on the front line. I was described on Sunday in one of the newspapers or one of the online blogs as a left field candidate for this role, and I am admittedly a left field candidate for this role. But I'm hoping that my experience and I hope that my career demonstrates my commitment to openness and transparency is something that I can bring to the agency in all the work I do. I want to make sure that we as a community engage in the most honest and transparent way we can. There will be disagreements, but those disagreements we need to have in public, and we need to have a debate now that's not just about us. It's not just about high quality care for all today. It's about high quality care for all now and for future generations. Thank you very much.